Good morning, everyone. My topic is anatomy of choroid. So, choroid it is a part of uveal tract which consists of iris, ciliary body, and choroid. Choroid is the posterior most part of the uveal tract. So, it is the posterior part of the vascular coat of eyeball. It extends from the optic disc posteriorly to ora serrata. Ora serrata, it is the point between the retina and the ciliary body, and its inner surface is smooth, brown, and lies in contact with the pigment epithelium of retina, and the outer surface of choroid is rough and it lies in contact with the sclera. It is thicker posteriorly than anteriorly. This is the choroid layer, red colored vascular structure. What is the function of choroid? As it is a vascular layer, so it provides oxygen and nourishment to the outer layers of the retina along with the ciliary body and iris, and it forms the uveal tract. Then we'll talk about the layers of the choroid. There are mainly three layers of choroid: suprachoroidal lamina, the stroma of the choroid, and the basal lamina. The suprachoroidal lamina, it is also known as lamina fista. The outermost layer of the sclera, it is also known as lamina fista. So it is a thin connective tissue layer which is present between the two. Then the stroma of the choroid, it is the main part of the choroid, and it consists of vessels. Large vessels, small vessels, and choriocapillaries. They are present in stroma. And then we have the basal lamina, which is also known as Brooks membrane. So now we will talk about the individual layer. Suprachoroidal lamina, it is a thin membrane of condensed collagen fibers, melanocytes, and fibroblasts. It continues anteriorly with the supraciliary lamina or ciliary body. The potential space between its membrane and sclera, it is called as suprachoroidal space, which contains long and short posterior ciliary arteries and nerves. The stroma of the choroid, it is the loose collagenous tissue with some elastic and reticular fibers. It contains plenty of pigment cells and other cells like macrophages. It forms the main bulk, and it is formed by vessels which are arranged in two layers. The third layer is the choriocapillary layer. The first layer is of large vessels, which is also known as Haller's layer. The medium vessel layers, it is known as Sattler's layer, and the third is choriocapillary layer. And it is difficult to separate the two layers. Large vessels are external and tend to diminish, and towards we go the choriocapillary, which is the innermost one. The choriocapillary layer, it is the rich capillary network which receives most of its blood from the medium and the large vessels of the stroma, and it nourishes the pigment epithelium and the outer layer of the sensory retina. These capillaries are fenestrated, and they have a wide lip and consist of endothelial cells lined by basement membrane, which contains pericyte on outer side of the capillaries, and it is divided into non-overlapping lobules in a fashion which is similar to seen that in liver. Now the basal lamina or the Brooks membrane, it is the innermost layer of the choroid. It is multi-layered in structures, and it consists of 5 layers when seen in electron microscopy. It consists of basement membrane of the retinal pigment epithelium, then comes the inner collagen layer, then middle elastic one, then outer collagen, and the innermost is the basement membrane of the choriocapillary. The Brooks membrane, it thickens with as on advancing age it gets thickened, and it produces a hyaline protuberance which is known as drusen's. What is the blood supply of choroid? As we know, the eye is supplied mainly by the internal carotid artery, ophthalmic artery, which is a branch of internal carotid artery. And ophthalmic artery, it divides into it gives mainly two branches, central retinal and the posterior ciliary artery. So choroid is mainly supplied by posterior ciliary. Posterior ciliary, it has two branches, the short ciliary and the long ciliary artery. So it is given here. there are two circulation of the eye, the retinal and the uveal. The retinal is the central retinal only, and the uveal is the posterior ciliary. Now the arteries of the uveal circulation supplying the uvea and the outer and the middle layers of the retina are the branches of ophthalmic artery, and they enter the eyeball away from the optic nerve. And the short ciliary arteries, they are 20 in number, and the long ciliary are 2 in number. Mainly the choroid is supplied by short ciliary, and the ciliary bodies and the iris are supplied by long ciliary artery. And this is the branching in the segmental distribution to the end arteries, they do not anastomose. This is clinically significant for disease affecting choroidal blood supply. This is for choroid. And ma'am, should I explain iris or ciliary body? Okay. So anterior most we have iris, then we have ciliary body, and posterior most we have choroid. These all forms the uveal tract. Sorry. Ciliary body, it has two parts, pars plana and pars plicata. Sorry. So iris and the pars plicata part of the ciliary body, they forms the anterior uvea, while the pars plana forms the intermediate uvea and the choroid forms the posterior uvea. So iris, it is a muscular structure. It consists of two muscles, the sphincter pupillary and the dilator pupillary. Sphincter pupillary, it is a circular muscle, so its function is it causes meiosis, while the dilator pupillary, it is a radial muscle, so it causes mydriasis of the eye. The sphincter pupillary is supplied by the parasympathetic nerve, the short ciliary nerve, and the dilator pupillary, it is supplied by sympathetic long ciliary nerve. Choroid venous drainage is by vortex veins. They are 4 in number. The superior inferior temporal and the superior inferior nasal, and they drains into the cavernous sinus.